Well, I guess that because I'm a general internist, a lot of my research has focused on the physical health of homeless people. And I think that a lot of the research has focused primarily on mental health and substance abuse issues among people experiencing homelessness, which I think is reasonable given the fact that those are very common problems among people experiencing homelessness. But at the same time, I think that not enough attention has been paid to the physical health problems that they experience. And so I think that it's an interesting and really important area to focus on. I think that the other reason that I think it's really important is that it's often the physical problems are what cause a lot of death and disability in homeless people. So I think they're really important areas to look at. And I think that the other reason that I think that they're useful is that just on a very practical level, often we can identify fairly straightforward interventions that might improve their health. Well, that's a huge question. I guess that based on my research looking at the health and healthcare of homeless people, I think that the challenge of providing coordinated primary care for homeless people's physical health needs is a real challenge. And I think that what we have is a system that in Canada, which admirably ensures that almost everyone has health insurance, but which doesn't necessarily ensure that they have access to a primary care provider whom they trust and have confidence in, and coordination of the care that they need for their complex physical and mental health conditions. So I think that that's where the system falls short, and there's a lot of room for research and practice to improve that. I think that the other important thing that we need to be looking at is the fact that so much research has on homelessness and health has focused on describing the problems that homeless people have and just telling us how bad the situation is, and not really giving us solutions that we can move forward through. So I think that we need to do more work that gives us practical answers about solutions and interventions to make things better. So I think that the greatest challenge is probably the fact that, I think that the problem of homelessness has been sometimes characterized as purely a housing problem or primarily a health problem. And I think the greatest challenge, or the greatest thing that we need to address, is the fact that it's both, that many homeless people need housing. They need affordable housing with either rent supplements or rent subsidies that allow them to live in dignity. At the same time, they have a lot of health problems that need integrated management. And I think that efforts to do one without the other are doomed to fall short of addressing the real problem. And I think that what we need to do is to integrate those two approaches, rather than saying we just need more housing or we just need to provide better health care. It's recognized that there are many different ministries or silos within government that need to be brought to bear to address the problem. I think that we should also be thinking more broadly in terms of engaging members of the business community, people who are, just in the general public who are engaged in the issue, and trying to really work together and build a consensus that it's an important issue that can be solved, and to find the resources needed to address problems. I think that, clearly there is a lot of room for government agencies that address either housing or health or mental health or physical health to come together and address the problem. But I think that rather than waiting for government to do that, I think we need to encourage Canadians in general to hold themselves and our society accountable to meet the needs of some of the people who are most vulnerable in our society. Well, probably the most exciting project that we're working on, we have two projects that are very exciting. One is a study called the Health and Housing in Transition Study, or HIT study, that we're doing that's going to follow homeless and marginally housed people in Toronto, Vancouver, and Ottawa over a 2-year period to see what happens to them, how often homeless people get out of homelessness, and what happens to their health and use of healthcare services when they make those transitions in and out of homelessness. So that's a very exciting study that we're doing. And then another very exciting study is the Mental Health Commission of Canada's project, which is going to provide rent housing first with rent supplements and case management services for homeless people with mental illness. And that's an intervention study that's a randomized controlled trial that will hopefully provide really important evidence about what works and how cost effective an approach to end chronic homelessness can be. I think the most controversial area is that of harm reduction for people with substance abuse. And I've written on this area, and people who've read what I've written have kind of assumed that I have a very, dogmatic approach to it. I think that harm reduction is something that we need to talk about and really consider in more nuanced terms, because it's an issue that lends itself to, I think, black and white extremism, where people say either it's a wonderful thing that we don't try to get people who are using substances to stop, we try to reduce harms, and that is pitted against people who say that that approach is enabling or encouraging substance use and not really helping people. And I think that what we have to do is get beyond this kind of conflict and realize that for some individuals who are homeless and severely addicted to substances, that harm reduction may be a useful approach among many other approaches that we need to offer, but that it's not the be-all and end-all, that harm reduction is not necessarily the ideal solution for helping people with addictions, that it's simply one tool that we should consider using where the evidence supports it. So I think that we need more research studies that really examine harm reduction in a rigorous way, and I think we need certainly more light and less heat on the issue.